I am the president of Vietnam Psoriasis Association. We call Soviet. And Soviet is founded 10 years ago. At this moment, we have 10 years old. 2020 is the big challenge to our member and for all our people in Vietnam. COVID-19 stopped all the meetings, and you can see the association of the patient when we have a meeting face-to-face always better because we need to share our psoriasis and our problem. When the people see each other, it's more effective. I think the podcast is one very successful program we have. We have 4,000 reacher, we have 5,000 reacher, and some program we have 10,000 reachers. I think that in 2020, we made almost 20 videos. Almost every 2 weeks, we have one video. And podcast, we made every week. This is our activities. We do the books, we do the radio program, we do the video, we make a meeting, a Zoom meeting, and we do the live stream, and we share what we can do on the different platform. Is more important. We think that can access to the patient as much as possible, not only to the patient, and for their family, and for the society also. Because you understand that stigma is a big problem for the skin disease patients.
Hi, everyone. Apologies for the slight technical glitch there. Glad we were able to get back on course. And thank you, Tran, for sharing your story of the Vietnam Psoriasis Association from 2020. Congratulations and kudos to your whole organization for so much tireless effort and countless resources you provided to your members. Your passion to fight societal stigma against skin disease is inspirational. If you want to see the video, please again visit the Global Skin YouTube channel. Now, our final informational session today is called Demonstrating the Impact of Skin Disease Through Data. You'll know it as our GRIDD project. Global Skin's novel patient-led research project will create a new tool that will measure the impact of dermatological diseases on patients. Today, we'll learn about the data gathered during the phase 3 Delphi and what you as Global Skin member can expect in phase 4 of the project. All of this data collection is laddering up to patient leaders and patient organizations effectively using data to further advocate for efforts. I'm pleased to welcome members of the GRIDD research team, Jennifer Austin, our Global Skin CEO, Professor Chris Bundy from Cardiff University, she's our co-lead researcher, Rachel Pattinson from Cardiff University, our PhD candidate, and Nirosha Trialonis Zutikaran from Hamburg University, and she's also a researcher. Last but not least, I'd like to welcome Anna Darzina, who's our project manager from Swiss Forward. The team will be available at 2 p.m. following this presentation to take your questions in the Q&A session starting immediately after this session. I know they have a full presentation prepared for us, so without delay, over to you, Jennifer.
Thank you, Michelle. So really pleased to be with everyone again for this important session about GRIDD, the Global Research on the Impact of Dermatological Diseases. This is a multi-year project. Many of you have heard about this, but we also have a lot of new members who may not be very familiar with this project. So we're going to give you a good overview of the project as a whole. So ultimately what we want to do as an organization, but certainly by using data We want to change the way that the world sees dermatology. We want people to understand the true impact of what it's like to live with a skin condition and all of the things that go along with that for them and their families and caregivers. And currently, we're in the situation where health technology assessment bodies really do want to hear the patient voice. However, unfortunately, many patient organizations don't have the ability to generate their own data, particularly quantifiable data. And they do have patient stories. Sometimes they have qualitative data, but it just doesn't really fit into how those decision makers decide about treatments, whether they're approved, paid for, covered, etc. And so we want to empower you as patient organizations to have that data, to be able to do that work. And our vision is really around measuring quality of life with a tool that's developed by patients. So it's not injecting the researcher bias, it's actually it's injecting the bias of patients, which is very important. We consider that a good bias. And wouldn't it be amazing if credible patient voice could be built on this data? And it would be incredible if policymakers would never make decisions without including a patient-led measure. And dermatology is going to be the first one. So we are leading the way in health. So here is what GRIDD is all about. It's the first in many ways. So it is the first research from that patient perspective on dermatological conditions. It's also patient-initiated research in dermatology. It's also the first data set that we're going to be generating on burden of disease in multiple dermatological conditions. We're also, in order to gather this information, we are developing a new patient measurement tool called PRID, Patient Reported Impact of Dermatological Diseases. And in order to actually create that tool, we had to develop a new methodology in order to do that. And that's something that we can actually share with other therapeutic areas. That's the GRIP, that's the global research on impact on patients. So many firsts coming out of this, but probably for you as patient leaders, the most important one will be that new measure and that data. And what do we hope to do with this data? We want to dispel the myths that are associated with dermatological diseases. We want people to understand, and that's both the public, but also the policy and decision makers, that these diseases really have a significant and long-lasting impact in many ways on these patients. And we want to be able to measure that impact. So this is where the data will come in. The objectives of the research project, and this is multi-year, and we have achieved some of these already, to conduct an extensive literature review, see what else is out there around measures currently, develop this new global measure, PRID, gather the patient-derived data globally, and create a robust database of all of that data so it's housed in one place. So together, we are working with our patient organizations to make this a reality. We cannot do this without the patient organizations getting their patients involved. And you'll probably hear us say that a few times today. The success of the project really relies on us all working together. And together, we're going to design a new incredible measure of impact of disease, something that's never been done before. We're going to validate and confirm your patients' needs for improved care, better treatment, and affordable medicines that work. We're going to leverage new scientifically validated research and provide you with supportive programming so that you can build your evidence-based advocacy work. And we're going to strengthen your advocacy messaging. And hopefully by doing that, you'll be able to attract more funding and more attention for your disease and build your group's credibility and voice. You've met some of the members of the research team. This is just a quick overview. Obviously, Global Skin is very involved with this, but also the University of Hamburg Medical Center and Cardiff University. And we have two co-lead researchers, Professor Matthias Augustine and Chris Bundy, Professor Chris Bundy, who is with us today. And we're grateful to our funding partners who have helped to make this possible. Doing research is quite time-consuming, intensive, and costly. And this is the reason that we're doing this with you, because we know that many of you are not able to do it on your own. So these partners are helping to make this a reality. As I mentioned, this is a multi-year project. So these are the phases, and we are going to go through these phases with you today and give you an understanding of where we are, what's been completed, and what's in progress, and what is still to come in terms of patient organization involvement in this project. So I am going to now turn it over to Nero. Sorry, Rachel. I'm turning it over to Rachel.
Thanks, Jennifer. So, as you know, or may not know, patient-reported outcome measures are also known as PROMs, and these include measures like the DLQI, which you may be aware of. And they're important, as Jennifer said, because they're used in clinical trials to measure the effectiveness of a treatment and in clinic to make treatment decisions. So the first phase of the GRIDD project was a systematic review of all published dermatology-specific PROMs. In other words, we collected and analysed all the relevant studies about the development and validation of a PROM that was designed to specifically measure impact across dermatological conditions. And that was because PRID is intended for use across conditions. So we didn't look at disease-specific measures. So the results of this study are not a comment on those disease-specific measures, which I know some of you here might have been involved in developing. We wanted to know the quality of the existing measures and whether any of them could be used to measure the impact of living with a dermatological condition. So we conducted a very comprehensive review. In all, we screened almost 13,000 relevant articles to identify 36 unique existing dermatology-specific PROMs, including the DLQI. We followed the COSMA methodology, the gold standard tool, to systematically and transparently evaluate each of those 36 PROMs and make evidence-based recommendations for the use. What we found was that none of these PROMs were capable of measuring the impact of dermatological conditions. And our results also revealed a lack of good quality PROMs. As you can see at the bottom right of the screen, no PROMs fell into recommendation category A, meaning that none could be recommended for use according to the robust scientific criteria. And this was largely because there was a lack of patient input during the development process, which again supports what Jennifer said earlier about it's really important that we have your input into the development process. So what our systematic review ultimately showed was that measures that are currently being used cannot measure the impact of the condition and may not be fit for purpose. From our results, we knew that PRID needed to be developed with patients at the centre of the process, and that PRID would be unique and important because it filled the gap left by existing measures. A key part of the research process and the GRIDD project is getting our results out there. And we've submitted our paper on the systematic review to a high quality dermatology journal, and we've presented it at a range of esteemed international conferences, such as the EADV. So now that we know there was a real need for PRID, we started to develop it. And the first step in the development of any patient-reported outcome measure is to define what it is you're trying to measure. Now, the impact of a dermatological condition on a person's life is quite an abstract concept because we can't see it. It's not tangible. We can't hold a ruler up next to impact or put impact on scales to measure it. This means that we have to do quite a lot of work in the early stages of development to make sure that what we're measuring with PRID is actually impact and that we're measuring it comprehensively and accurately. And we do this by speaking to people like yourselves to gain a rich, in-depth understanding of how dermatological conditions affect the patient's life. And we had really rich and diverse data set to work with because 68 people from 29 countries and representing 29 dermatological conditions spoke to us. And that meant that we had a really solid foundation to build PRID on. We analysed that information to develop what is called a conceptual framework. And this is basically a visual representation of the impact of dermatological conditions. And it's the first step in the development of GRIDD, and I'll talk more about that in a moment. But first, on the screen here is a high-level overview of the results of this interview study. What we found was that dermatological conditions impact individuals, organisations and society, and also vice versa. And this explains why experiences might be different across regions or cultures. Second, we found that there are different forms of impact. Some are point in time, such as pain or itch, but some can be cumulative in that they affect the person's life course. For example, what career they follow and the decision to have children. Finally, we found that though impact is individual for each person, there are common issues across conditions, and it is also multifaceted in that impact involves several factors. And we identified 5 factors, that they were the physical, psychological, social, financial, and daily life and responsibilities impacts that were common across conditions. So here's the conceptual framework of impacts we developed based on the interviews. Essentially, the framework shows that any instrument that aims to measure the impact of dermatological conditions on the patient's life must include the 5 domains shared across conditions that we identified in the centre of the screen. The conceptual framework is used to develop the items for GRIDD, items meaning the questions or the statements in the measure. And on the right hand of the screen, I've given an example of items for each of the 5 domains of impact. So for example, based on our findings, the social domain of impact should ask people about their experiences with social isolation, with romantic relationships and other people's reactions, amongst other things. Again, it's important that we get our research out there. So we'll be publishing a journal article on this phase of GRIDD, and we'll be presenting at international conferences on the right across this year. So now I'll hand over to Neera.
Thanks, Rachel. So I will be presenting phase 3 of the GRIDD project, the Delphi study that is currently in progress. What is a Delphi? A Delphi study is a way of systematically establishing consensus among experts on a particular topic. So as the people living with these conditions, the patients are the experts on the impact of dermatological conditions. So we wanted to establish consensus between people with dermatological conditions on what were the most important impacts of their conditions to them. So the purpose of the GRIDD Delphi, therefore, was to move from the long list of 263 impacts, which were just presented by Rachel, to the first draft of GRIDD with patients driving the process. So the Delphi study allowed us researchers to access a large number of patients from anywhere in the world and allowed patients to make a vital contribution to the development of the new measure GRIDD. It also had the added benefits of allowing us to test whether the impacts we identified in phase 2 were endorsed by a wider group of patients and gave patients an opportunity to add any impacts they thought were missing. So usually Delphi studies consist of several rounds of questionnaires. Delphi had 2 rounds where patients completed an online survey, ranking how important the impact items were to them. So we have launched round 1 last year in September, in December, consisting of a demographic and a Delphi survey on 263 items in 6 languages. 1,154 participants from 61 countries representing 90 dermatological conditions took part in round 1. The patient's contribution helped us to start shortlisting the main impacts of living with dermatological conditions for inclusion in GRIDD. So we were able to reduce the number of items while retaining much of the impact information by changing the wording of the items based on the feedback the patients provided. In round 2, we took the shortlisted items back to the same participants to test their importance and use the item list further. So we have closed round 2 just this morning and have over 450 responses. The data analysis of round 2 will start tomorrow. So my colleague Anna is going to present the round 1 data only. So I'm going to turn over to Anna.
Thank you, Nero. So in the survey number 1, there were 1,978 registrations, out of which around 58%, or 1,154 participants, fully completed the survey number 1 and later were invited to fill out the survey number 2. There were 61 countries represented, with the top 10 countries being USA, Germany, UK, Canada, Australia, China, Argentina, the Netherlands, Portugal, and Spain. Consequently, the top languages were English by far, Spanish, German, Chinese, Dutch, French, and Portuguese. There were 90 diseases represented, with the top 5 being psoriasis, atopic dermatitis, pityriasis rubra-pilaris, alopecia areata, and pemphigus vulgaris. The age groups were quite well distributed, with the top group being 50 to 59-year-olds. And there was even one person who is 94 years old. Back to you, Nero.
Thanks, Anna. So on behalf of the whole GRIDD team, we would like to thank the patients and patient organizations for their effort and support of being part of the Delphi study. Without your input, we would not be able to complete this phase. So we received many positive feedbacks from patients and patient organizations during round 1, saying that they were very thankful for the opportunity to take part in the research and share their experience of living with a dermatological condition. They also felt rewarded, relieved, and being heard. So thank you to all of you. So I'm now gonna hand over to Jennifer.
Thank you, Nero. I'll also mention that we had challenges with our patient population in China because of firewall protection that's put in place by their government. And so we were actually still able to gather that information by doing it through PDFs that they were filling. And our patient leader, Fen with the psoriasis organization in China, was instrumental in helping us to reach patients. I want to mention briefly that while we are obviously creating a measure to collect a very big data set, we do have data now because we've closed the second round of the Delphi. So we will be analyzing this data, obviously to move forward with developing GRIDD, but also so that we can determine how best to find insights that we have already collected from patients through this process and share those with you as patient organizations to help with your advocacy work. So this interim data is something that we're looking at closely and we'll be providing you with more information about. I'll turn it now back to Rachel.
So we only received the data from the Delphi round 2 this morning. And in the meantime, we will start to analyse the data and we'll develop the first draft of GRIDD. And any first draft of a measurement instrument needs to be pilot tested with the people who will be completing it. And in this case, that's you, that's the people with a dermatological condition. And we call this pilot test cognitive interviewing. In a cognitive interview, the respondent is asked to complete the measurement instrument while the reviewer asks questions about their choices, their thoughts, and their experiences as they complete it. And the key purpose of this is to test whether PRID works in the way that we intended it to. This means testing whether respondents understand the questions in the intended way and whether they're willing and able to provide the required information. The cognitive interviews therefore allow us to find out whether there are any issues with PRID, such as ambiguous or poorly worded items, and make refinements to the measure based on patient feedback. To do a robust pilot test, we'll need to speak to about 30 people with a dermatological condition in a cognitive interview. We're planning to be doing the interviews over July and August this year. And as Jennifer said earlier, the quality of PRID really relies on patient input. So please do get involved so that we can develop a measure that works for you. So before we go on to the next step, it's important, I think, to step back and think about what makes PRID or any PROM a measurement instrument rather than a simple survey or questionnaire. And the answer is that we have, each item has a score, and these are often summed to get a total score. And these scores imply that PRID is a statistical instrument, which means that statistical assumptions need to be met for it to work properly. So in the previous phases, we were trying to make sure that what we were actually measuring was this abstract concept of impact. And in the psychometric phase, this is the final phase in PRID's development, we're testing whether PRID works as a statistical tool. And there are 2 steps to do this, which means that we'll need your help twice. In the first step, we'll ask you to complete PRID, and we'll do some tests to make sure it works as a statistical tool. And for example, we'll check whether those 5 domains of impact that we saw in the conceptual framework are can be seen in the measure, and we'll be checking for any problems with any of the items. And based on what we find, it's very likely we'll make some final refinements to PRID, so we might remove some items or reword them. We'll then ask you to complete the final version of PRID, and we'll use that data to check the quality of PRID in the way that we did for the other PROMs that we identified in the systematic review. We'll also use this data to understand what the scores actually mean. So say you complete PRID and you get a score of 20. So what? What does this mean? Does this mean your conditions had little impact on your life, or it had a really severe impact? And what about someone who scores 25? Are they much more impacted than you, or is the difference not meaningful in real life terms? With that data, we'll be able to answer these questions so that you, dermatologists and researchers, know what a score on PRID means. So once we have the final version of PRID, we can start to collect the global data on the impact of dermatological conditions so that you can use that data for your advocacy work. While developing PRID, we've followed best practice and developed the measure in one language first, so in English. So the next step will be to start translating the validated version of PRID into different languages. And we'll also start to develop some disease-specific add-ons. We'll be working in this phase 4 to disseminate PRID and provide training on it to a range of stakeholders.
Thank you, Rachel. So we'll invite Professor Chris Bundy to comment on this aspect of the project and also some of the next steps that will be coming that have impact with you, the patient organizations.
Thank you, Jennifer. And hello, everybody. And I wanted to pick up on just a few things so far that have been alluded to, but not really talked about in detail. The first thing is, despite the SARS-CoV-2 pandemic happening and has affected us all, data collection didn't stop. And I think that's something that we should celebrate today, because that's a massive thank you to Rachel and to Nero and to all of you particularly the patient organization, organization leads, who continued to provide us with a link to patients. The only way that we could contact patients was through the patient organization leads. So we are immensely grateful to you for providing patients and for acting as a conduit of information between us doing the scientific work and you being the patient-facing organization. Really big thanks to you for that. And likewise, a big thanks to Vahid and to Anna, who built the Delphi, the 2 rounds. No small feat. That is a huge amount of work to ensure that patients had good access to be able to give us the information. And what Rachel and Nero have talked about so far is what we call data triangulation. Jennifer mentioned it right at the very beginning, and that was the quantitative data speak to the healthcare providers and healthcare funders, and that is numbers. But of course, what we've been able to do is to work with the qualitative data. That is what you have told us that we have digested, synthesized, and made into this new measure, and been able to put that information about impact within the context of the numbers that will talk to the healthcare funders. So we've brought together, we've triangulated qualitative information and quantitative information. And as Rachel very nicely outlined right at the very beginning, the gold standard measure is entirely dependent on having that good qualitative basis on which to develop the quantitative, the numbers and the scale, if you like, of a tool such as the DLQI or any other tools that you're familiar with. So that was an essential part of the process. And this is why we are fairly confident that our measure is going to be the gold standard, because although Rachel pointed out that no single measure was ideal, there was no gold standard out there. Of course, there are measures being used. They're being used in daily practice, and the DLQI probably is the one that's used most often. That does not mean it's the best measure. It just means it's the one that is good enough. Well, we don't think good enough is good enough. We want to have the gold standard, the best measure. So this new methodology has meant that we can't cut corners. We can't criticize other people and the measures that they've developed, if we then come behind and create the same problems. So we've had to be ultra careful with not cutting corners. And this has taken time. And I really appreciate the fact that all of you have been incredibly patient to get to this stage, phase 4. We're not quite finished yet. There's another phase, but to get to this stage has taken a lot of time. It's taken a lot of money from Global Skin, the organization. We fully appreciate that. But the reason is that we're setting ourselves up to be the gold standard, and therefore we can't afford to cut any corners or to take any shortcuts. Right, so having said that, Rachel very nicely has told us what cognitive interviewing is. I just wanted to say one thing about that. Can we just go back a slide? Because there's a point I wanted to make on the last slide. So about cognitive interviewing, it's about sense making. It's about us double checking with you every step in the process, that you really understand why we've rephrased something, why we've used a different word, or why we've put it in the context of a statement or a question. And we have to do that two-way cognitive interviewing, sense checking, because otherwise we're working from our own assumptions. And of course, our own assumptions are based on experience, but they're not the experience of you living with the skin conditions. Okay, so what we plan to do next, the next steps are entirely dependent on you, as the others were. We will be coming back to you as patient organization leads, and we will ask you to find another group of patients with us to participate in this sense-making, sense testing and making exercise, the cognitive testing. We will do some interviews, we'll do them remotely, and we have to do them on a one-to-one basis because we want to get into the way that that person is thinking about the questions they're being asked. We really need to try and understand their thought processes and test out whether our assumptions about their thought processes are accurate. So from the back end of 2021, October, November, we will be asking you to encourage the patients in your organization to participate in the surveys, because the more data and the best quality data that we have, the best that we can make use of the psychometric testing. What does that mean? It means it's if you think about it in terms of a highly sophisticated shuffling a pack of cards, playing cards, and organizing them in a particular way. There's lots of ways that you could organize that deck of cards. You could put all the twos together. You could put all the colors together. You could put the pictures and the numbers 1 to 30 and so on. You can cut the pack in any kind of way. So we will have to test that mathematically as to which is the best way to sort that deck of cards in a meaningful way. And so we need volumes of data, information from patients to be able to do that accurately. Early in 2022, we will be coming back to you. As Rachel has said, we will make sense of the information that we've got from the survey, first round of the psychometrics, and we'll be asking you to do the same thing again, having thrown away the items that don't seem to make a lot of sense to the majority of people or to a significant number of people. And that could be because the question or the item is covered by another question. So we will be asking you to do that exercise again, having taken some items out. And also we need to ensure that when you complete the survey at time 1 today, let's say, if we come back to you in 2 months' time, would you complete the measure in the same way? Or are there important differences between the two? And if so, we need to know what those important differences are. So is there another slide, Jennifer?
No, that's it, Chris. I'm gonna sum up quickly here. Thank you.
Yeah, just very quickly to sum up, we need you.
Thanks. Thank you, Chris. So yes, and Chris is absolutely right. We need you, but also I think you need this data. And so, you know, this is going to help you in the end have more credibility using this evidence-based advocacy approach, having the data that is so needed for that. It's going to provide you with outreach opportunities to your patients by asking them to participate in these different rounds of the research. And you can see the responses earlier about the Delphi and how gratifying and rewarding that was for patients. We know that it's a lot of work on your part, but there will be benefits of having these touch points. You're going to be able to use this data with media relations, boost your fundraising, and make your case for how significant an impact your disease really has on people. And you're going to be a key part of this movement that we're building going forward, which is based on evidence. And so at the end of the day, you'll have the data, which you'll be able to see in many different forms, whether it's by disease or region, demographics. You're going to be supported with advocacy tools and training to be able to take that data and actually do something tangible with it. And so we're empowering you at the local level, while at the global level, we will be doing outreach and advocacy work as well with the UN, the World Health Organization, and building public awareness campaigns that you'll be able to use in your own country. So together, we are going to strengthen the voice of patients through data. And that is the bottom line, what GRIDD is all about. And it's about supporting you to do the work that you need to do. So with that, I will conclude and just say a really big thank you. We're so grateful for all of your involvement and support. And we look forward to continuing this work with you.
Thank you, Jennifer. And thank you to all of the presenters from the GRIDD session today. Rachel, Nero, Anna, and Chris. This project is truly going to help all patient organizations advocate on behalf of their patients with the all-important data that we all need. Thank you for helping make this happen for our patient organization community. Okay, so wow, what a great day, huh? What a great program. Thank you everyone for joining us today. We have come to the end of our formal presentation and conference. We're so thrilled to have seen so many faces and had a chance to connect with patient leaders across the world. The work that you do for your patients is vital and makes a meaningful difference in so many lives. We at Global Skin are privileged to be on this journey with you, so thank you for being there. We're once again grateful to our conference sponsors for their support in making this event happen. Thank you to all of our presenters today for sharing their knowledge and expertise with us. I also want to give a shout out to the conference committee and Global Skin staff for putting together such a great day for us. We're truly blessed to have such amazing people working for us and with us. Exciting times are still ahead of us as the Global Skin community continues to grow and thrive. And we're very hopeful in the World Health situation, when the World Health situation permits, to see many of you in person. I'd really like a hug from a few of you. While I'm closing the official program, please don't forget to join us in the Q&A sessions starting now. Jump into one of the 3 rooms available. So don't forget, Yes Kramer, our keynote speaker, will be joining us. Maria from UPatty will have a session, and the GRIDD research team will answer questions about the Global Skin Project. Don't forget to also take a minute to fill out the event feedback form found on the My Event tab of the platform and all the sessions you attended. Continue to meet one-on-one throughout the afternoon and evening, and we wish you all well. Stay safe, stay healthy, and let's look forward to meeting in person in 2022. Lexi, over to you.
I take this opportunity to thank Global Skin for supporting us so we can better support our members.
So I'm very thankful for the support that we're receiving from Global Skin.
I can't think of anything else that Global Skin could be doing. What more could they do, or what could they support us doing forward? They could just keep doing what they're doing because it's perfect.